Christina, and I'm a nurse here. And I'm going to be performing a head-to-toe evaluation on you. If I could have your initials and date of birth for me.
BN 2/17/1985.
Okay, great. We're going to start with the neurological portion first and ask you a few questions. Do you know where you are today?
I'm in my house.
Okay, and do you know what today's date is?
August 4th, 2022.
Okay. So I'm going to have you start at 100, and I want you to count back for me by sevens.
Okay. 100, 93, 86,
Okay,
79.
thank you. So I evaluated the patient's attention span for 1 minute, and it was intact. Next, I'm going to tell you. I'm going to ask what you did for your birthday.
I went to dinner with my family.
Okay, great, thanks. And now I'm going to have you remember 4 words for me. I want you to count back, starting at 20. Okay. So, cat, dog, car, toy.
Okay. 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Cat, dog, toy, car.
Okay, great. So I'm going to hand you this piece of paper. I want you to read it and just follow the directions. Okay, thank you. So attention span, comprehension was good, intact. Okay, so next I'm going to just assess your skin here. Skin is warm, dry, and intact. Any tenderness? You feeling any tenderness?
Nope.
Capillary refill, less than 2 seconds bilaterally, in the upper extremities. And then I'm going to assess your legs here. Are you feeling any tenderness?
Nope.
Normal hair growth, capillary refill in feet, bilaterally equal, less than 2 seconds. And I'm just going to assess for any pitting edema, and there is no pitting edema noted. Next, I'm going to just assess your skin turgor. And normal skin turgor. So I'm going to assess your head next. And is there any tenderness felt here? Are you feeling any pain or tenderness?
No.
Okay, no infestations noted. No normal ear distribution, bald spots, and good texture. Okay, so I'm going to have you look at me, and I'm going to just touch right here. Is there any tenderness here in your sinuses?
No.
Okay, so no tenderness noted in sinuses. Next, I'm going to just palpate right here, just touch your temporal arteries. Okay, 2+ regular, bilaterally equal. I'm going to have you, I'm going to just touch your TMJ here, your joint, your jaw joint, and I'm going to have you open your mouth. Yep, and then close. Any tenderness?
Nope.
Okay, next I'm going to feel, palpate for any lymph nodes. Any tenderness noted here?
Nope.
Okay. Okay, and then I'll have you lift up your arm. Okay, and then on this side. Okay, and no tenderness noted, no tenderness, and no palpable lymph nodes noted as well. Okay, next I'm going to have you just look at the tip of my pen light here and just follow it with your eyes, okay? Okay, great. Next, I'm going to have you look at the wall behind me, and then look back at the pen light. Okay, great. And you're going to again look at the bridge of my nose. Okay, like eyes accommodated. And I'm not seeing any, so first of all, pupils equal, round, and reactive to light and accommodating. I'm not seeing any redness. Sclera is white, and I'm going to just touch your eyelids. If you could just close your eyes. Yeah, thank you. And no tenderness here. You don't feel any tenderness?
Nope.
Okay, no mass is felt. And then I'm going to have you just try to open your eyes against my hand. Perfect. Great. And no pain with that?
Nope.
Next, I'm going to have you raise your eyebrows, and then smile, and then frown, and then puff out your cheeks, and then purse your lips. Great. Next we're gonna assess your ears. So I'm gonna first inspect. I don't see any discharge. Any tenderness when I'm doing this?
No.
Okay, any tenderness when I'm doing this?
No.
Okay, no discharge. So I'm gonna have you just close one ear, and I'm gonna whisper a few words. I want you to repeat them to me.
ABC.
Okay, and then close this one.
1, 2, 3.
Okay, great. Next I'm going to just assess your nose here. It's midline, and I don't see any abnormalities. If I could have you look up to the ceiling. Okay, and I'm just going to check the ears. I don't see any deviated septum, any lesions, or drainage. And next I'm going to just close one of your nostrils, and I want you to breathe in and out through your nose. Okay, it's patent, and this one. And both mirrors bilaterally are patent equally. And then now I'm going to have you close your eyes, and I want you to tell me what this scent is.
Peppermint.
Okay, great. So after that, I'm going to have you open your mouth, okay, and stick out your tongue. Okay, say ah. Perfect. And then I'm going to have you stick out your tongue like this, and then up, and then down, and then side to side. Great. All right. And then I'm going to have you clench your teeth. Okay. And then move your jaw back and forth. Okay. I'm just assessing the cranial nerves, and everything's intact right now. Great. So when I assessed his mouth, I did not notice any kind of lesions, any cracked teeth. Mucosa was moist, pink, and no redness noted. Okay, so next I'm going to just look at your neck here, and the trach is midline. I'm going to just assess your carotid artery here. Okay, right here. Okay, so carotid arteries are equal bilateral, 2+, and then right here. Temporal arteries are equal, 2+, regular, and then I'm just going to listen for any bruits. Okay. I'm going to have you hold your breath. Okay. And again, hold your breath. And you can release. Okay, no bruits heard. In the temporal or the carotid arteries. Okay, and I'm going to have you just shrug your shoulders, push against my hands. Great, thank you. Okay, so next I am going to have you lay here for me, face up with your head here, and I'm going to have you look to either side, the right side for now. You can start it like that. Okay, so look towards the right. And I'm just checking for JVD, any kind of jugular vein distension. Okay, and the other way. Thank you. And I'm not seeing any pulsation. So now I'm going to have you come, actually lay right there for a second. I'm going to have you, now we're going to just jump right into another evaluation. So I'm going to have you lay on your left side with your arm up. Yep. Up over your head. Great. And I'm going to just go mid-clavicular line to the 5th intercostal space, and I'm going to just assess for any thrills or abnormal pulses, and I feel a normal pulse here at the PMI. Okay, great, thank you. So next I'm going to have you sit back over here on the chair, bench. Okay, so I'm going to have you just put your arms out like that. Great. So brachial and radial pulses, regular 2+, bilaterally equal. Next I'm going to just feel your femoral arteries here. Okay. Okay, 2+ regular, popliteal behind your knees. 2+ regular, ankles here. And then dorsalis venus. Okay, so all of your lower extremity pulses are equal, bilateral, 2+ and regular. So next, I'm going to listen to some heart sounds. Midclavicular line, fifth intercostal space, apical pulse. I'm going to listen for 1 minute. I hear S1, S2, and heart rate. I would listen for 1 minute. Heart rate was 68. And then next I'm going to listen for any kind of abnormal heart sounds with my bellow, my stethoscope. Okay, and no abnormal or extra heart sounds heard. I've assessed the skin already, so I know that there's no skin breakdown. Did you need to use the bathroom? Because next time, soon I'll be doing a abdominal assessment. Okay, great. So we're going to do a respiratory assessment next. I've assessed the skin, and any tenderness noted here. Okay, great. So I'm going to listen. I'm going to start with percussing your skin. And this is just your lung fields, okay? So I'm going to do 5 spots in the front on either side and then 7 on the back. Over here. Okay, so lung fields on all interior and posterior are resonant and sound, laterally equal. Next I'm going to take a listen to your lung sounds. Every time you feel the stethoscope on your body, just take a deep breath for me, okay? So we're going to listen to 5 spots in the front and 9 in the back. And on the back side. And if you get dizzy, just take a break with the breathing. Okay, great. Lung sounds posterior and anterior are equally bilateral and clear. So next I'm going to have you just say 99 for me.
99, 99, 99.
Okay, and that sounds good. If you could say 99.
99, 99, 99.
Okay. Next I'm going to have you take a nice deep breath for me. Okay, and then breathe out. Okay, bilaterally equal expansion of the chest. So next I'm going to have you lay down here for me, facing up. Okay, further up this way if you can. Great, thank you. So I'm inspecting the stomach. It's flat. Any pain in your stomach right now?
Nope.
Okay, so no pain. I'm going to listen to the bowel sounds for 30 seconds in each quadrant, and then also arteries. All 4 quadrants of the bowels are normal active. Next, I'm going to listen to arteries. So the aorta, renal, and femoral. No bruise heard. Next, I'm going to percuss in each quadrant in a zigzag pattern, 3 times in each quadrant. Okay, and the tympanic sound was heard in all 4 quadrants. Next, I'm going to palpate. Do you feel any tenderness here?
No.
Any tenderness here? No mass is felt. Okay, no tenderness. Great. So I'm going to have you sit up now for me and sit back over here. Great. So next, I'm going to have you, I'm going to assess some range of motion and some strength, okay? So I'm going to have you look down for me, look up, yep, great, and then look side to side, great, and then ear to shoulder, great, and then look side to side, but against my hand, yep, and push against my hand, and push against my hand, so 5 out of 5 in strength for the neck, and range of motion is within normal limits. Next, for your shoulders, we've already tested strength, so I'm going to have you just follow my lead. Put your hands straight out, up to the sky, out to the sides, in the back, around, and then give yourself a hug. Great, good range of motion in the shoulders. Next, I'm going to have you put your arms out like this, yep, and then in, and then out, and then push against my hand, and then push against my hand, good, and then hands out like this, and then like this, okay, and then go like this, in and out, yep, great, and then up, and then push against my hand, and then push against my hand, put your hands down like that, great. So good range of motion in all extremities, in all upper extremities, and bilaterally equal, 5 out of 5. Next, I'll have you stand up, and I'm going to have you bend backwards as far as you can, yep, safely, and then forwards, if you could bend forwards, great, and then straight back up, and then I'm going to have you bend to the side, and then bend to the other side, and turn, yep, exactly, your waist, yep, great. So normal range of motion. Next, I'm going to have you lay down facing up again. Okay, so I'm going to have you lift your legs, just kind of about like, yep, right there is good, and then I'm going to have you cross your feet, and then out like this, and then cross the other foot over the top, yes, great, and then back down, and then push against my hand, great, good hip strength, 5 out of 5, normal range of motion for the hips. Next, I'm going to have you point your toes towards your face, yep, and then towards the wall over here, yep, and then push against my hand, okay, and then push like that, down, okay, great, and now squeeze your toes together, down and in, yep, and then let them, yep, space them apart, yep, great, and so normal range of motion for feet and toes, and 5 out of 5 for strength, bilaterally equal. Next, I'm going to have you face on your back, on your stomach, face on your stomach, and I'm going to have just check your strength, check your normal movement back here, and I'm going to have you just lift both legs at the same time, your whole legs from your hips, yep, so put your legs straight out, and then lift your legs, yep, great. Okay, so now I'm going to have you just sit at the end of the bed here, okay, and I'm going to have you kick your legs out, okay, back down, and then push against my hands, great, normal range of motion in the knees. I'm going to have you also lift your knees to your chin, yeah, great, so normal range of motion for the knees, and 5 out of 5 in strength. Next, I'm going to have you sit back here, and I'm going to have you just copy what I do, okay, just hands on the thighs, and then you're going to just go quick like this, very as quick as you can. Great. Thank you. And that's good. Next, I'm going to have you touch your nose and then my finger. and then back to your nose and back to my finger as fast as you can. Okay, great, thank you. That's great. And so next I'm going to have you close your eyes, and I'm going to have you tell me what you're feeling, okay?
Okay.
So this is dull, and this is sharp, okay?
Mm-hmm.
So tell me what you're feeling.
Dull. Sharp. Dull. Sharp.
Okay.
Dull. Sharp. Dull. Sharp.
Okay, great. Next I'm going to place a couple things in your hands, and I want you to tell me what they are, okay? With your eyes closed.
Paperclip.
Yep.
And the pen cap.
Okay. So with your eyes continually closed, I'm going to have you check. I'm going to check one more thing. So I'm going to have you put your hands out, and I'm going to write on your hands, and you're going to tell me what I wrote. Okay?
An 8.
Okay. Great.
B.
Okay. Great. So graphesthesia and stereesthesia are intact. So I'm going to have you stand up, and we're going to do a Romberg test. This is just where you close your eyes, you keep your feet together, and I'm just assessing if you're swaying. So look forward, yep. So I would assess for 30 seconds, and I don't note any swaying during those 30 seconds. Next, sir, I'm going to have you stand right here, and I'm going to actually assess your vision. I was supposed to do this earlier, but I forgot. So I'm going to have you close one eye with your hand, and I'm going to have you read line 8 for me. If you want to get a little closer.
D, E, F, P, G, T, E, C.
Okay, and cover the other eye.
D, E, F, P, G, T, E, C.
Okay, and then with 2 eyes, can you read it again?
D, E, F, P, G, T, E, C.
Okay, great. Next, and so you're 20 feet away, so you have 20/20 vision. Next, I'm going to have you walk normally, like you would, towards me. Yep, great. And then I'm going to have you turn around, and I'm going to have you do heel to toe back this way. Yeah, and next, can you go on your tippy toes? Yeah, and then on your heels. Walk with your heels. Great, thank you. So have a seat right here. I just want to make sure I've completed everything. And I'm just trying to think. Make sure that we're doing your whole head to toe here. And let me see how much time I have. Okay, so I just want to make sure we're getting everything. And I think we're pretty good here. So I'm pretty confident with the evaluation we did for your head to toe. Thank you for your time, and have a good day.
Thank you.